Hi, it's Jackie from Cambridge Safety. Welcome to our latest instalment of our Take 5 presentations. Take 5 minutes or thereabouts for one specific aspect of workplace health and safety. In this short presentation, we're just going to have a quick look at reviewing performance. Plan, do, check, and act. Reviewing performance is about checking and acting, improving on what we're doing. Are we getting better or are we getting worse? Because if we know that, we know then what things we're going to need to target. So, in terms of reviewing performance, is there any legal requirement to review performance? Not really, but the closest bit of law that we've got is Regulation 5 of the Management of Health and Safety at Work Regulations, 1999. Every employer shall make and give effect to such arrangements as are appropriate, having regard to the nature of his activities and the size of his undertaking, for the effective planning, organisation, control, monitoring, and review of the preventative and protective measures. How easy is that? But basically, what Regulation 5 is saying with regards to the size of the company and the resources and the type of work that we're doing, we need to make sure that we plan for health and safety, we organise ourselves for health and safety, we control it, but also then we monitor and review it. And what they're talking about is our preventative and protective measures, the things that we do to make sure that everybody is safe, our control measures. So this is as close as we're going to get. But it's a good thing to do, but it's not necessarily a legal requirement. It's definitely a requirement, though, if you have any form of health and safety management system. This is a quote from HSG 65. Organisations can maintain and improve their ability to manage risks by learning from experience. So very much reviewing performance, plan, do, check, act. And that check and act is looking at improving our performance. Let's learn the lessons. Something's gone wrong. Let's have a look at why. What can we do to stop it happening in the future? So normally reviewing performance, as opposed to audits, reviewing performance is what you do yourself. It's normally internally led. And it should also be reviewing performance, looking at what worked well, what went well. So it's not all negative indicators. It can be positive indicators as well. And we might decide to review our performance on regular planned intervals because we want to see, are we getting better? Are we getting worse? And then if it's going up or down, what do we need to do as a result? So thinking in terms of if you're reviewing performance and we're doing it internally, what documents or procedures perhaps might need to be reviewed regularly. So we know that you have to review your risk assessments, your policy, your safe systems of work, maybe your training and these types of things. So that's reviewing, but we're actually looking at reviewing performance. So we might look at documents, but we're really looking at performance. Are we doing better? Are we doing worse? So documents that you might examine to identify your level of performance could be your health and safety policy. Are we still complying with it? Our risk assessments, have the actions been implemented? Have they been reviewed? Workplace inspections, what hazards are being spotted? Have they been dealt with? Or is it the same hazard again and again and again? Behavioural safety observations, is it the same type of thing? Can we see after a communication actually people's behaviour is improving or is it actually just declining? Internal audits, these are going to look at our work systems, our policies, our procedures and how they're actually being followed. And we might examine external doc audits, even though this is an internal thing. If you've got an external document, external audit, what was our score? What were the non-conformances? What have we done to deal with those? But also, where are we now? Compare that to last year. Were we worse? Was the score better? Was it worse? Accident reports, the type of accidents, our accident trends, accident investigations, not only just have they been done, but have any remedial actions actually been carried out, finalised? Have we closed the loop? Because it's about learning the lessons. The number of complaints that we've had, and that could be internal, external in terms of health and safety. The minutes of the Health and Safety Committee, what actions have they been suggesting? Have those actions been undertaken? Civil claim information. Have we had any civil claims? How much have we had to pay out? So these are, again, things that can help us identify our performance. Is it getting better? Is it getting worse? We don't want any enforcement action, but if you've had improvement notices, prohibition notices, fee for intervention. Again, is it more, less? Have we had one in the past, but now we've done things so we haven't had any more since? So data, again, just a little bit more on that. Data which you might examine is you might look at accident trends, days lost, the number of incidents or accidents, as I say, enforcement action, cost of accidents, cost of claims. And again, this is like quantify. So you've got the documents, you've got the data that you might get. What we're looking at is quantifiable, because are we getting better or are we getting worse? Results of our risk assessments, number that have been reviewed. Again, the results of inspections, number of hazards, number of controls undertaken, key performance indicators, objectives, goals, targets. Are we actually meeting them? Results of any internal or external benchmarking, maybe comparing us to HSE data on number of accidents for our particular industry. Noise levels, again, are they going up or down? Results of any health surveillance, have we had more cases of asthma or less? So you've got your documents, you've got the information, but then when we do our review of performance, it needs to be quantifiable. Are we getting better? Are we getting worse? So when we're analysing our data in the review of performance, we might look at accidents and incidents in one particular area or part of the organisation. It could be comparing them to the organisation as the whole. Is the trend going up or down? But also, what's the patterns? Is it more manual handling accidents compared to machinery accidents? Is it slips and trips? So it's that patterns, that's again performance. The incident rate, the number of employees in relation to accidents, and number of accidents per 100,000, that type of thing. Frequency rate, the number of accidents per 100,000 hours. And again, is it going up? Is it going down? Epidemiology and epidemiological studies, looking at the part of the body that's been injured the most, the area of the organisation that's had the most accidents, and again, is it going up or down? Doesn't tell you why they're happening, but it does give you a picture. So we've got some data, and if you think the Health and Safety Executive, every year they publish their data on health and safety in the UK as a whole. They are reviewing performance. It's a review. So how well are we doing? It's an internal evaluation of our health and safety management system and policy to see if it's working. We evaluate our performance as are we getting better or worse or staying the same? We're looking at measurable indicators. We're checking progress against targets and objectives. We're reviewing action plans. Have we done the things that we said we were going to do? And if we haven't, why not? What do we need to do about it? That will lead to new targets, new objectives, new plans. Equally important thing for reviewing performance, there needs to be some senior management involvement, senior management buy-in, because otherwise, if we do this, does anything happen as a result? It's all very well getting all the data, but do we learn the lessons? Do we ensure then that the key issues that we've highlighted then need to be dealt with? So reviewing performance, it is part of plan, do, check and act, part of continuous improvement. Thank you very much for listening and watching this presentation. It's Jackie from Cambridge Safety, www.cambridgesafety.co.uk. Thanks very much.